everyone. This is Maria Rodriguez with Kaweah Health coming to you live for a breaking news update on how we are working to solve the nursing shortage that is happening all across the state of California and what we are doing to mitigate this problem in the Central Valley. With me here today is Carrie Nowaski, our Chief Nursing Officer at Kaweah Health, as well as Dr. Abdel Yosef, who's the Provost and Chief Academic Officer at Unitech Learning. Welcome.
Hi, thank you, Maria, and thank you all for joining us today. We are here to talk about We're here to talk about the collaboration between Kaweah Health and Unitech in the nursing and how we're going to solve the nursing shortage for our area. This is a reality across our country. Here at Kaweah, we currently have 220 open nursing positions. These are RN positions. Pre-pandemic, that number was more like 60 to 80 at a time. We recognize the need for taking action and doing something very different to solve this nursing shortage. So throughout the pandemic, it has only worsened. So the actions that we're taking are outside the box thinking, and we're very excited about them. We partner locally with colleges and universities, and these universities and colleges do give us nursing graduates routinely every year. But those are not enough to fill the new gap that we have in the number of nurses needed. So this summer, we started working with Unitech and developing a program to have a nursing school at Kaweah Health. That through the course of the summer and into the fall, we've worked with Unitech and the Board of Registered Nurses. Last week, the Board of Registered Nurses got together and unanimously agreed to increase the nursing seats in our area by allowing Unitech to come to Kaweah and start a program. So we are excited to introduce that program here at Kaweah. We'll begin our first cohort of nursing students in March of 2023. So the process is starting now. We have already had a lot of community interest as the nursing schools are impacted. But this will only be open to our Kaweah Health team members at this time. We have 80 to 100 different team members just here who are ready to join the program. So we will start with those current employees. But as the program progresses and is a permanent program for nursing student candidates across the county, we'll be able to expand that into the community as well. We really could not have done this without our partner, Unitech. We are very grateful, and I'm going to turn the mic over to Dr. Yosef now.
Thank you, Carrie. I appreciate that. And as Carrie said, the nursing shortage in Tulare is huge, and it has been like that since like before the pandemic. The pandemic just made it worse. And part of our mission at Unitech Learning is to expand nursing education opportunities to the community that are considered underserved community, medically underserved, or also considered as a shortage area for nursing. At Unitech Learning, we believe that healthcare providers should be representative of the community they serve. When this is true, the ripple effect on the entire community is truly life-changing. The impact ranges from poverty to healthcare outcomes. So imagine when the patients see themselves in the healthcare workforce, it raises the trust and encourages preventive care. When career pathway and better than good wages are available and allow people to stay within the community, the wages allows them to stay and benefit everyone. I believe that bringing this school into Kaweah Health will help improve access to healthcare, improve the quality of care, and definitely improve the community, the entire community in the valley. So we're very excited. This is a milestone in our history as Unitech Learning, and we appreciate the partnership with Kaweah, and we're gonna be partnering to prepare the future nurses who are gonna be safe, competent, and caring nurses. Thank you, Maria. Thank you, Carrie.
Thank you. It's amazing to hear what we're trying to do here in the Central Valley. Really, we're kind of pioneering the way for the rest of the state to truly bring nurses into our area where we need it most. And it's something that's been happening all throughout the pandemic, or largely through the pandemic, and continues today. But I know we're getting some comments on social media as well as media questions. And I just want to ensure that people are commenting in on the importance of what we're doing to bring nurses and educate nurses into our community, because it's not just about bringing travel nurses or bringing people from elsewhere, but honing in on the talented people that we have right here at home. One of the questions that we received for Carrie from ABC 30 is what percentage of staff do we have currently open at Kaweah Health from the 220?
The 220 recognize it is about 20% of our staff, or our nursing staff. So we have about 1,000 nursing positions total. So with 220 open positions right now, it is a significant number of those of people that are missing from the team.
Now, Carrie, what are employees currently doing? Will they be able to backfill their positions, or how many can we put through the program at once we start it?
So the program, when we start the program, the first cohort that starts in March will take 3 years, because we will likely have that cohort will be students who don't have any prerequisites that are completed already. So they'll be starting from the base of the education and earning their bachelor's degree when they're done. So 3 years from March, they will have 25 new nurses that are ready to join the workforce. And then in September, we'll start another cohort. And that cohort, again, will be start with 25 students. Could possibly be the 3-year program again. If we have enough candidates in that program that apply who have those prerequisites that are needed, it could potentially be a 2-year program.
Thank you, Carrie. Now, Dr. Yosef, what's so great about this partnership? We understand that we are pioneering this movement to try to bring more nurses, but is there anybody else doing what we're doing right now and truly bringing in nurses and educating them on serving the patients in the Central Valley?
Exactly, Maria. This is exciting because this is unique. Remember, if people remember, nursing school used to started 100 years ago on hospital facilities, and then they became more of an independent institution, an entity of education. What we're doing, we're bringing the school back to the hospital, and this is unique in multiple ways. One of the ways is that usually in order to increase educational capacity, you need two things. You need faculty and you need clinical experience. You need clinical facility and rotations. This partnership actually provides both, because the nurses are working at Kaweah, and the senior nurses could participate in teaching and preparing their colleagues who's going to become nurses working for them. And also, Kaweah Healthcare opened their doors for our students or their employees to do all the training and the hands-on practice. So this is a very unique partnership, and that's the only way to solve nursing shortage. The only way is to really partner, and we need everybody to participate in this effort, because nursing shortage is going to get worse. The last research says 22% of the nurses between the age of 55 to 64 will resign in the next 2 years. And that's the majority of nurses. The average age of a nurse is around 56 or 54. So technically, many of the nurses, they're going to resign in the next few years, and we're going to need to be running to refill all these positions. But we appreciate this partnership because it increases our educational capacity.
Absolutely. Now, Carrie, how many students do we plan to have for each class, and what type of non-nursing positions will also be available?
So each class will have 25 students, and then we'll do that twice a year. So 50 students total a year. Right now, the plan is only to have a nursing program, but we are interested in looking into the future at other licensed professional programs where we see a need in the Central Valley. So we have areas like respiratory therapy, therapy aids, our ultrasound and cardiac sonography. So a lot of opportunities out there to expand this so we can bring the education to our community.
Thank you, Carrie. Now, Dr. Yosef, where do you see this partnership growing with Kaweah Health? And are you guys doing any other partnership with another health system like you're doing with Kaweah Health?
That's a great question, Maria. That I believe this is going to grow and expand over the years, as we said, because the shortage is going to get, is going to become more and more, and we need to partner with the entire valley area. Visalia needs as many nurses as possible. We're excited about our partnership with Sierra View Hospital, which is a neighbor to your hospital, to Kaweah, and we starting with them a cohort, two cohorts per year, starting next year. We also have many other healthcare system and healthcare partners that are reaching out and asking, can we do the same what you guys doing with Kaweah Delta? I mean, we're excited for this. And Unitic Learning, just so you know, we are a large educational institution. We have 17 campuses across 6 states. And we teach these nurses and prepare nurses from Idaho all the way to Reno. So we have all these campuses across all these states, and we're ready to partner with as many clients as possible. And something excites me personally is going to the rural areas, the regions that are considered a desert area for nursing. There's no schools around them. They need the help, and we need to prepare those nurses. So when we grow up, when we need the care, they can help us. They can be there for us.
Thank you, Dr. Yosef. I'm going to stick with you. How many nursing licenses have you guys had gone through the program? So how many actual participants have gone through the program and gotten their licensing?
Oh, we have a large vocational nursing program in California. We're the largest nursing program in California for vocational nursing. We have more than 1,000 nurses every year become licensed from our schools in Unitech. We also have about 700 nursing students at our BSM program across all the states we have. So we are very big on preparing pre-licensure nurses, and we do a really good job with that. And we are excited about this partnership because it's going to help us open the doors for our students to do the hands-on practice. Nursing is a practice profession. We need to give these nurses the students the ability to practice under the supervision of our qualified faculty. So as a Unitech Learning, as an entire entity, we have graduated so many nurses around the country, and I get so excited. I'm a nurse myself for 30 years. I get excited when I go to hospitals to visit and I see my graduates are helping patients in the outpatient setting or in the hospital or in home health and other areas.
That is wonderful. You guys are both leaders that are hands-on, really care for patients, and you guys are also leading the way for others to do the same. Now, we have a question on LinkedIn from Corinne Higard, and she says, what does it mean to be 220 nurses short for your staff? And this is for Carrie, for patients.
Sure.
What does that mean, Carrie?
So that means that when we look at our routine daily census, what we project to have throughout the course of a year, day to day, we estimate how many nurses that we need for each of our patient care areas. And then we have openings and positions for those nurses and we bring them in. So of those positions that are out there, we have 220 of them that are bedside registered nurses that are unfilled. So that's that 20% that I mentioned earlier. The way that we fill those, so that means 2 to 3 shifts a week, there's not a nurse in those shifts. And what we do is have agency nurses, like Dr. Yosef had mentioned earlier, as well as extra shifts that our staff sign up for. We also have a role called per diem nurses. So that doesn't really count in those employed shifts that we say when we say we have so many nurses that we need to cover so many shifts. We also have people we call per diem that work kind of as needed. They do so many shifts in a schedule. So those are the resources that we use now to fill the shifts. We don't work short. We use the resources that we need and we fill our shifts. And we routinely have regular staffing in place. What happens though is with the travel and agency nurses that come in, they are not from the area or don't spend a long time at Kaweah. We don't have a lot of time to give them the orientation that they need, so that they would have if they were a regularly employed nurse, a full-time or a part-time person with Kaweah. So we lose some of that investment when they come for maybe 6, 8, 13 weeks. I will say we have agency nurses that are here for 6 months to a year who do become a regular part of the team, and we appreciate that work that they do and the care that they give, because they stay here and they become part of the team and really commit themselves to our patients and our community. But we're looking into the long term and the feasibility of using agency nurses really is a very expensive resource. So we do need to have people that we employ and we invest in the long term on our team.
Thank you, Carrie. Now, one more question. We're going to stick with you. What is the community response to this partnership with Unitech? What is everybody saying? What is the hope in the community?
Oh, so the community has been very supportive, very excited, and impressed, I would say, too, because it's definitely outside the box thinking. We are partnering with our community colleges and universities and helping them and how they can expand their seats as well. But it's a lot to take on for some of these programs because of the demands for faculty and clinical sites that they have to manage with already large numbers. So everybody doing a little bit of expansion, including Kaweah with these 25 seats, can help bring more to the community. And it's really been well received. Our team especially is excited. We sent out a notice the other day about the BRN approving the program, and people are already emailing, just asking, do you think I could do this? What do you think? And how, and just really excited to be involved and have this opportunity right in front of them.
Thanks, Carrie. We have another question from LinkedIn. Corin is asking, what is a starting salary range for nursing students, or that nursing students can expect to earn upon program completion? And this question is for Carrie.
So at Kaweah, it would be about $85,000 a year. That would be about starting for a new grad.
So Carrie, can you tell us what this will look like? What are the next steps for this program once we start and get it going?
Yeah, so what we first will do is vet our internal candidates. So there is an opportunity for them to apply internally first, and we will go through all of those individuals on our team. We have an interview process, we have an essay, letters of reference, and then once we have all those candidates vetted from our team, we will forward them on to Unitech, and the students will apply with Unitech. Unitech will go through their application process and admitting and selecting the 25 students who will start the cohort. Once those students are selected, they'll be informed that they are starting in March, and then in March they will start their program. Between now and then, we'll work with Unitech to build the faculty and help with getting team members from our organization or the community on board with as faculty for the program, help with just the logistics of spaces and where everything will take place and clinical rotations, which a lot of that's already been worked on by Lacey Jensen, our director of clinical education. So we're just kind of been working as we waited for approval, working on a lot of these pieces, and now it's just putting it all into action.
Thanks, Carrie. Now, Dr. Yosef, in your experience, how successful are partnerships like this with Kaweah Health, and what are the next steps? What do you think this could do for our community?
Absolutely. I think this is going to be a great success story that we will share and tell in our, in the future. One thing that is very important that Carrie mentioned is that what's unique about this is that we're opening the enrollment for the internal community in Kaweah Health. Now, when I studied the area, the whole San Joaquin Valley area, we notice that there are always students who come from outside the community. They come just to enroll in the area, they take the education, and then they go back to whatever county they came from, LA or San Jose. So the community does not benefit from these graduates. What's unique about what we're doing with the Kaweah Health is that we're enrolling internal candidates who currently work and live in the community, and they're most likely going to stay with Kaweah Health and help build that workforce in the region. This is a very successful program since we are partnering as the leaders and at all levels in the organization. So we as the chief nursing officer, myself as a chief academic officer, the whole executive team support this, and faculty, directors, and staff, everybody is joined to support and dedicated to support this program, because I believe this is going to be a great program that's going to prepare nurses to help the community. And when I say about healthy community, I mean healthy from physical, mental, and financial, improving access to healthcare by preparing 50 BSN graduates. Every year, we're going to enroll 50 nurses, that the candidate that become a bachelor prepared nurse. This is going to bring a lot of prosperity and health to the region that Tulare County needs that. And we're fully dedicated to make this a success story.
Thank you, Dr. Yosef. Now, before we move on, we want to remind our community members that if they have any questions or our meetup partners, you can always text the number 559-280-9374. We're almost getting close to ending our session today, but we want to make sure to give you the opportunity to ask those questions. Now, we have a question that was submitted by Corin, and he asks, do students do the program for free, right? And then they commit to 3 years of working for Kaweah as a nurse. Carrie, can you help answer this question?
So the program itself will not be free for the students. They will still have a responsibility for a portion of the tuition. Kaweah Health is helping with subsidy for the program, and Unitech has decreased the amount for the program because of the partnership and the subsidy from Kaweah Health. And then the students will have their own financial responsibility for their college education as well. And then but with the subsidy and the support from the tuition reimbursement piece from Kaweah Health, the students will have a 3-year obligation to work at Kaweah after they graduate, or will have to repay the subsidy.
Thank you, Carrie. We're going to stick with you with one more question. Taylor Mungum on LinkedIn asks, Carrie, how are you listening to your nurses and improving their experience based on that feedback to increase retention and reduce churn?
Reduce churn. So as best we can, meeting the market rates that are in the area, working to build them sustainable just staffing models that they have in their units, making sure that they have the team members around them that they can rely on and provide the care, giving them the best environment possible to provide the care, which is why this partnership with Unitech, though 3 years before we see the first graduates, will help with that long-term sustainability of bringing in team members. One of the key parts in healthcare in general, but especially nursing, is who do you work with day to day and how do you take care of those patients together? And we really need to build that in each of our departments and in our units for our team members. When they go to work, the team that's around them, who they work with, is what makes their day to day that much better. And we want to build that consistency and strengthen that we have some really strong teams. We have some great groups right now working together. They've built, we just, with the gaps in the number of nurses, we can't do that everywhere because of the turnover with our travel nursing industry. So trying to minimize the temporary employees and bring in permanent employees and really work on those environments that people are working in.
Absolutely. And we also want to let people know that we have a shared governance committee where nurses can voice their opinions and they can really work through regular engagement to see what best practices work for patients and have a healthy work environment. Right, Carrie?
Yes, absolutely. Thank you for that, Maria. I appreciate you bring that up because that is actually where we encourage nurses to take action on their units in their divisions and then at an organization level. And we meet routinely throughout the month. A lot of decisions go through that group, and we value the input that's there. A lot of those groups do improvement projects on their own units, and I'm supportive of the work that they do because they're the ones that are at the front line. So their voice and their decisions they make impact a lot of what we do for nursing practice in the organization.
Thanks, Carrie. So we're wrapping up very soon, but do either of you have any more additional comments you want to tell to our community about this amazing partnership? And we'll begin with Dr. Yosef.
Thank you, Maria. I appreciate it. I think this nursing shortage is a patient safety issue and a public health issue. So it is a crisis now, and we need all to act together and work together to solve this workforce shortage. And this partnership is a great example that we encourage colleagues, partners to work together, and we encourage healthcare system to reach out to us. We are well positioned to work with other healthcare providers in many of the states that we're in because nursing shortage, unfortunately, is just going to get worse.
Thank you, Dr. Yosef. Carrie?
Yeah, we're very, very excited about offering this unique opportunity and this just unique take on nursing education. I'm really excited that the Board of Registered Nurses saw the value in it as well. And they've also approved expansion of some seats in our College of Sequoias program. So there's a lot of growth going on in our community around nursing education. And our focus really is to offer that to students in our community because we want to build people that are invested in the Central Valley, invested in the care that's happening here, and keep people here wherever they may go to do the nursing, take care of our community here in the Central Valley. So thank you to Unitech for presenting the program and for letting us partner with you.
Yes, from Kaweah Health, on behalf of Kaweah Health and Unitech, we appreciate everyone tuning in on this press briefing. If you have any additional questions, you can always reach out to the number 559-280-9374. Again, thank you for joining us, and we're excited about this partnership. Till next time.
Thank you.
Thank you.